So I'm Angela Vetch. I'm the Director of Lab Services at Kootenai Health in Coeur d'Alene, Idaho. We are a little under a 400-bed hospital, I think, licensed for about 397 beds, and Kootenai serves the 10 northern counties of Idaho, or the kind of the referral area, but we see patients from all around northern Idaho, eastern Washington, Montana, sort of all around the region. As a result of, some sales of other nearby labs, and we had this non-compete agreement for a number of years. During that time, seeing the challenges that there were with partnering for lab services with an external commercial lab presented some challenges with physicians on our end not feeling like they had the level of control or ability to follow up on issues. There was a lot of work done to assess, what would it look like if we brought these lab services in-house, doing some business planning around that. Since we were already partnering with them on the inpatient reference lab side, it was really a seamless conversation to kind of go to them and say, we have these plans to expand our business. How can you guys help? It was very easy for the Mayo team to explain that as we grow and we're sending less to you guys, that enables you to focus on the more esoteric tests. But also as we grow our business, we still have, an increased need for some of those reference lab tests. So ultimately we do still grow your business as well as we grow. So it's a really nice synergy to see that and be able to explain to our executive team and to people that we're working with in the community what the benefits are to everyone involved. Our 3 locations were previously run by the commercial lab that we were partnering with. So at the same time as our EHR conversion, we were opening up these locations kind of over the course of a weekend. They shut down on Friday. We went live with our EMR on Saturday, and we were open on Monday for patients, which, I wouldn't necessarily recommend if you want to keep your hair, but I think it was a really big effort on our team's part to just get the equipment in there, get all of the workflows established beforehand, do as much pre-work as we could. Like our busiest site, I think we projected to see 100 patients a day, and we routinely see 180 patients a day. We're a year and a half in, and we're looking at what's the next location we need to open because we're kind of bursting at the seams. It's been an interesting transformation to go from when we did have the non-compete agreement. When that expired, we were able to work with Mayo, and the Outreach Insights consultation arrangement was really helpful in the Mayo team coming out and doing an assessment of all the different aspects of our outreach program, which was still kind of in its infancy over the past year, and seeing where we were on couriers and logistics and financial arrangements and billing and all of the different aspects that you need to be successful has been really helpful both for the lab team and for our hospital executive team to see where our strengths are and where our areas of weakness are to better allocate resources and kind of create our own strategic plan within the lab to address those areas and really be able to hit the ground running more and expand our services to the community. It's really exciting to see that from the stage of being an idea or the next thing we need to do to something that we're actively doing and maybe have even done in the last year. So, and then that enables us to serve more patients and keep that care closer to home for them. So yeah, it's been a really fun ride.